viewers, welcome to Science TV 1 PM News. We update you on what's happening in our country and international. I'm your host, Videlis Njoki, and that is my surname and my sign language interpreter doing the voicing, Irene Chebiwot. Let's focus on our first news. President William Samoei Ruto on Wednesday warned hospitals and individuals implicated in defrauding the Social Health Authority, SHA, saying stern action will be taken against them. He stressed that those found guilty will face prosecution and be compelled to refund all illegally acquired funds. The head of state made remarks while addressing a delegation of more than 6,000 leaders from Kiambu County at State House in Nairobi. He noted that the government will not tolerate any attempt to siphon public resources meant to improve healthcare services. Ruto added that funds unlawfully obtained from the SHA must be refunded, whether by institutions or individuals, as part of efforts to safeguard accountability and restore public trust in the country's health system.
Ya bilioni 30 haiwezi kufanyika ndani ya SHA. We will make sure the digital system, the digitization process of SHA is what is making us to detect all the fraudulent claims, all the ghost hospitals, and all the fake patients that are attempting to carry out fraud in our health sector. And I want to promise the people of Kenya, we have already closed close to 1,000 health facilities. We are not going to stop at closing the facilities. We are also going to make sure that they refund the money if ever they have been paid. And thirdly, we are going to prosecute them because it is criminal to steal money meant for patients. It is criminal to steal public resources using whatever means. So, watch this space. SHA is going to work because we are going to eliminate fraud. Nyinyi mnanielewa? Tunataka afya iwe haki ya kila Mkenya, bila ya kujali ako na pesa ama hana pesa. Sikizeni watu wa Kiambu. Health can no longer be a privilege for those who can afford. It must be a right for every citizen because it is documented in the Constitution. Tunaelewana? Nataka munisikize tena. Kama umejiandikisha kwenda kwa dispensary, kwenda kwa health center, utaenda health center kwa sababu wewe ni mgonjwa, uende kwa dispensary kwa sababu unatafuta matibabu, utatibiwa, utaona daktari, utapatiwa dawa, na hapo utoke uende nyumbani bila ya kuulizwa pesa yeyote. Munisikize tena vizuri. Nataka munisikize vizuri. Mumenisikia? Nimesema hivi. Serikali ya Kenya, hawa wabunge wenu hawa, tumepitisha kwa bunge shilingi bilioni 21 kuhakikisha ya kwamba kila mmoja wetu ambaye anaenda kwa hospitali, ile outpatient, ile unaenda unatibiwa na unaenda nyumbani, haupaswi kulipa pesa yeyote. Nyinyi mnanielewa? Mimi najua bado kuna mahospitali, na nilisema juzi wakati nilikuwa hapo Limuru, bado kuna mahospitali, bado kuna counties ambazo wanaitisha pesa wananchi. Hiyo mahospitali, nyinyi mnanielewa? We are going to prosecute them because it is against the law to charge citizens for a service the government of Kenya has paid for.
Moving on, Health Cabinet Secretary Aden Duale on Wednesday claimed that some members of the National Assembly on health facilities implicated in the recent Social Health Authority (SHA) payment claim scandal. He was responding to calls from lawmakers demanding his resignation over the matter. Duale dismissed the demands, accusing the legislatures of engaging in blackmail to derail efforts to fight corruption within the health sector. He maintained that the government would not relent in ensuring accountability in the SHA operations. Earlier, lawmakers allied to the Kenya Moja coalition had demanded that the CS take responsibility for regular payments alleged made to non-existent hospitals. They accused Duale, SHA leadership, and powerful figures linked to State House of being behind the alleged fraud at the authority.
Resignation of Honorable Aden Duale, the CS for Health, for number 1, conflict of interest, number 2, complacency, uncovered evidence of deep-rooted conflicts of interest. The government has now resorted to arbitrarily reject claims, punishing facilities that raise concerns about SHA.
On to our next news. Activist Boniface Mwangi has officially declared his bid for the presidency in the 2027 general election, marking a new chapter in his journey from activism and social mobilization to politics. Mwangi made the announcement on Wednesday at Ufangamano House in Nairobi, a venue historically associated with Kenya's struggle for good governance. He said his decision to seek the top seat was driven by the need to transform the country's leadership and address deep-rooted corruption. The activist, known for his bold stance on social justice and accountability, stated that his campaign would focus on challenging the status quo and offering Kenyans an alternative to traditional political leadership.
Together and triumph together. Yet the reality is that since 2010, the promise of our constitution continues to be delayed. Our rights often feel like suggestions, and the constitution is treated like an option, not the law. Last year, I saw Kenyans shot in the streets for exercising their right to protest. Can you imagine? The young people are working hard in school only to be launched into a country that wants to send them abroad to work as servants. It is not yet Uhuru. It is not yet. I was only 3 years old when the Constitution was passed. Yet I know that we cannot give up on the promise of our Katiba. In 2027, I will get the first chance to register as a voter and exercise my right to vote. My generation has shown they're ready to give our strength, our commitment, and even our lives to achieve the dream of a prosperous Kenya. Now allow me to direct you to the screens for a short video.
A decision by the Council of Governors to oppose the transfer of nearly 8,000 universal health coverage UHC staff to county governments before the release of funds has sparked sharp criticism from nurses unions. UHC Secretary General Seth Panyako accused Tharaka Nithi Governor Muthomi Njuki, who chairs the Health Committee at the Council of Governors, of insincerity and of deliberate obstructing the transition of UHC workers to devolved units. Panyako urged Health Cabinet Secretary Aden Duale to proceed with original plan, insisting that the delayed transfer was undermining services delivery and demoralizing health workers across the country.
Issued by the chair of the Health Committee in the Council of Governors, Honorable Njuki, and the Kenya National Union of Nurses and Midwives strongly condemns the recent utterances by the said governor, who is the chairman of the Health Committee in the Council of Governors. He said that he is opposed to having the universal health coverage staff converted to permanent pension. And in his utterances, he issued certain roadblocks to the Ministry of Health, stating that he does not want them to be converted in permanent pension. We want to state as follows. One, that the NAN appreciate the Ministry of Health and the leadership of the Cabinet Secretary, Honorable Aden Duale, for initiating the conversion of UHC staff into permanent and pensionable. NAN recognizes the role of the national government and the National Assembly Health Committee for ring-fencing budgetary allocation to support this process. We also note and recognize the progress that has been so far achieved through the action.
On to our next news. 5 more bodies were exhumed on Wednesday at Kwabinzaro in Kilifi County, raising the total number of bodies recovered in the past 5 days to 24. The ongoing operation is part of a wider investigation into the disturbing discoveries in the areas. Government pathologist Dr. Richard Njoroge confirmed that several body parts were also retrieved during the exhumation exercise. He explained that the remains will undergo forensic profiling to determine whether they correspond to the bodies already exhumed. Police reported that 11 suspects have been arrested and are assisting investigators with crucial information. Authorities say the exhumations will continue as they work to uncover the full extent of the case.
4 graves. These 4 graves yielded 5 bodies. We also collected a skull not far away from one of those graves. So today we are speaking about 6 confirmed deaths. So collected many body parts scattered around the perimeters of some of the graves. So those ones will also be processed by DNA to see whether they match any of the bodies that we collect.
Tutasiti kukaa tu hivi kwa shamba kubwa kama hii 50,000 acres, and we don't want the same thing to
On to our final news. Potato farmers across the country have been encouraged to embrace modern technologies in order to boost yields and enhance the commercialization of their produce. Among the innovations being promoted is the use of rooted apical cuttings, rack technology, which provides farmers with clean, fast multiplying and disease-resistant seed. Experts note that this method has the potential to significantly improve productivity and reduce losses caused by pests and diseases. Agricultural stakeholders believe that wider adoption of such technologies will not only increase farmers' income, but also strengthen the potato value chain, contributing to food security and economic growth.
umuhimu wa cuttings, kwa sababu sisi tu kama mbeleni nyuma huko tumetumia ile kutafuta kwa jirani viazi iko ready, unapewa na jirani, kumbe anakupatia ugonjwa, unakuja kuweka ugonjwa kwa shamba. Lakini leo tumeona kutumia cuttings ni njia muhimu sana na njia rahisi, na unapata mazao mengi. Ile viazi tumeang'oa pale, tumeona iko na viazi kuanzia 25 na haina ugonjwa, na hiyo ndio umuhimu aswa kwangu.
Inatoa mazao mingi na tena gharama yake ya kukuza iko chini. Pia mbegu, pia katika kuuza ishakuwa tayari, bei yake uwanga iko juu. Kama saa hizi mbegu ya shangi iko kati ya 1,700 hadi 2,000, lakini hii unica saa hii bei yake ni kuanzia 28 mpaka 32.
Aina mingi ya viazi imerelisiwa na KEPHIS, lakini adoption kwa ukulima bado iko chini. So siku ya leo pia tumeweza kuleta aina kadhaa ya varieties. Tuko na unica, tuko na wanjiku na sasa shangi yenye wakulima wameizoea.